Hello and welcome. Today we're diving deep into a specific type of cataract known as a complicated cataract, or a secondary cataract. Unlike typical age-related cataracts, these cataracts develop as a consequence of other pre-existing eye diseases or conditions. Understanding complicated cataracts is crucial for effective diagnosis, management, and preserving vision. Let's explore what makes them unique. So, what causes a cataract to be classified as complicated? Well, the etiology is diverse. Conditions like uveitis, which is inflammation inside the eye, can be a major culprit. Glaucoma, particularly long, standing, or severe cases, can also contribute. Retinal diseases such as retinitis pigmentosa, retinal detachment, or diabetic retinopathy are frequently associated with complicated cataracts. Eye trauma, certain medications like corticosteroids used over a long period, and even intraocular tumors can also trigger their formation. Essentially, any underlying issue disrupting the normal metabolism of the lens can lead to a complicated cataract. Now, let's delve into the pathophysiology. In a healthy lens, proteins are arranged in a very specific way, allowing light to pass through clearly. When an eye disease or condition interferes, it disrupts this ordered arrangement. Inflammation, for example, releases inflammatory mediators that damage lens proteins, causing them to clump together and become opaque. Similarly, conditions affecting the retina can alter the chemical environment within the eye, impacting the lens's health. Corticosteroids, another common culprit, can also directly alter the protein structure within the lens, leading to clouding. The precise mechanism varies depending on the underlying cause, but the end result is always the same, a gradual clouding of the lens, hindering light transmission and affecting vision. Regarding epidemiology, it's difficult to pinpoint the exact prevalence of complicated cataracts as it's always secondary to another condition. However, we know they are more common in individuals with pre-existing eye diseases like uveitis, glaucoma, or diabetic retinopathy. The prevalence therefore mirrors the prevalence of these primary conditions. Additionally, patients on long-term steroid treatments are at a higher risk. Due to the nature of it being secondary, statistical analysis can vary depending on the population studied and the criteria used for diagnosis. The signs and symptoms of a complicated cataract are often similar to those of age-related cataracts, but they may be intertwined with the symptoms of the underlying eye disease. Blurred or cloudy vision is the most common complaint. Patients may also experience glare, halos around lights, and difficulty seeing at night. Colors may appear faded or yellowed. However, it's important to note that the symptoms related to the primary eye disease, such as pain from uveitis or vision loss from glaucoma, can sometimes mask or complicate the identification of the cataract symptoms. A thorough eye examination is essential to differentiate between the effects of the primary condition and the secondary cataract. Diagnosis of a complicated cataract involves a comprehensive eye exam. This includes checking visual acuity, assessing the clarity of the lens using a slit lamp microscope, and measuring intraocular pressure to rule out glaucoma or worsening glaucoma. A dilated fundus examination is also crucial to evaluate the retina and optic nerve, looking for signs of the underlying disease and its impact. In some cases, optical coherence tomography, or OCT, can be used to get detailed images of the retina and lens. Because the cataract is secondary, identifying and addressing the primary underlying condition is critical to proper diagnosis and management. While there aren't strict types of complicated cataracts in the same way there are for age-related cataracts like nuclear or cortical, they can be categorized based on the underlying cause. For example, a cataract caused by uveitis might be referred to as a uveitic cataract, while one caused by long-term steroid use might be called a steroid-induced cataract. This classification helps guide treatment strategies by considering the specific factors contributing to the cataract's development. The primary treatment for a complicated cataract is cataract surgery, similar to surgery for age-related cataracts. However, the surgical approach may need to be modified based on the underlying eye disease. For example, patients with uveitis need to have their inflammation well controlled before and after surgery to minimize the risk of complications. In cases of glaucoma, the surgeon may consider combining cataract surgery with a glaucoma procedure to control intraocular pressure. Careful pre-operative planning and collaboration between ophthalmologists specializing in different areas of eye care are crucial for optimal outcomes. Post-operative management also requires careful attention, including monitoring for inflammation, infection, and elevated intraocular pressure. Artificial lenses will be implanted following cataract removal, however. The lens type has to be carefully chosen after discussion with the doctor. Sometimes, the lens is not implanted depending on the condition of the eye. Preventing complicated cataracts primarily involves managing and controlling the underlying eye diseases. For example, Prompt and effective treatment of uveitis can help reduce the risk of cataract formation. Careful monitoring of intraocular pressure in patients with glaucoma is also essential. When corticosteroids are necessary, using the lowest effective dose and monitoring for cataract development is crucial. Regular comprehensive eye exams are key for early detection and management of underlying conditions, which can ultimately help prevent or slow the progression of complicated cataracts. The prognosis for patients with complicated cataracts depends heavily on the severity and control of the underlying eye disease, as well as the success of the cataract surgery. If the primary condition is well managed and the surgery is uneventful, patients can often achieve significant improvement in vision. However, the risk of complications is generally higher in complicated cataracts compared to age-related cataracts. Recent research is focused on developing new surgical techniques and medications to minimize inflammation and other complications associated with complicated cataracts. Also, new developments in intraocular lens technology is helping to improve visual outcome after surgery. Ongoing research into the underlying mechanisms of these cataracts will hopefully lead to more effective prevention and treatment strategies in the future. Thank you for watching.